Andrew, welcome to the show.
Oh, thanks so much for having me, Inka. Nice to see you again.
Nice to see you again. We've met and we've chatted a couple of times, and I've been to your lecture and a training about neurofeedback. And I remember it was like 2018 in Stockholm. I remember I was listening about this fascinating field, which was completely new for me at the time. And I was just scribbling notes, and I just found, I did find my notes. I had like 6 pages of, I wish I had my pad here so I could actually show you that I still have the notes from the session that you kept about neurofeedback. It was very fascinating, and I'm so excited to be chatting to you today about it.
Well, I'm so honored to hear that you we're excited to watch that and take notes. That's great.
Yeah, well, it's a very, very interesting new field, and it interests, I'm sure it interests so many listeners as well. And also even me, like right now, I have so many questions still about it. So can you please share a little bit about your past, your history? How did you become interested in neurofeedback in the first place?
Sure. So I have been involved with the brain, I guess, or interested in the brain for many years. And I started off after college. I worked for many years in different inpatient environments with residential adults who had developmental difficulties, and inpatient crisis psych and addiction and all kinds of so everyone at their most acute, if you will, in their human status, people who are suffering from major difficulties or major complications, if you will, of brain or mind things. And I ended up getting a little bit injured doing inpatient psych work. I was working in a very acute psychiatric hospital, and I was in charge of leading restraint teams and training people how to do hands-on restraints and things. And it was a very understaffed facility in Massachusetts. And I ended up getting somewhat injured and couldn't do that work anymore. And so I left psych for a while. After maybe 15 years working in the human services, I left and went to high tech for a while. And then the sort of tech bubble, this is around 2000, the tech bubble contracted a little bit in the US, the business bubble, if you will, business marketplace. And I ended up going back to human services. I missed it, and I had some experience with autism. So I went and found the local autism center that was doing something I'd heard about, this stuff called neurofeedback. And I hadn't really experienced it. It was sort of a fringy, it had been discovered many years ago, but wasn't used very widely, and no one really deeply understood it, it appeared. And I was kind of interested in it. And I went and got a job working in a center that did autism and some ADHD. And within a couple of months was really routinely having my mind blown by what I was seeing our clients experience. Symptoms change and resources improve. Our kids with profound autism developing eye contact, and routinely things like seizures and sensory issues going away, ADHD going away. I mean, just amazing things against the backdrop that I had experienced before, which is chronic, very little change, a lot of suffering, very little, very poor tools we have to help people move through transformation. And I was seeing a huge amount of transformation in the neurofeedback space, so to speak. And yet at that time, I would say now it's still true. We don't deeply understand it in some ways. It's more of a phenomena we manage. But back then, certainly there was 3 or 4 big schools of thought about how you do neurofeedback and how it probably works and how you'd approach it. And these schools of thought were all in conflict with each other. They have different ideas that were not reconcilable. And yet they were all getting really good results, better than conventional, so psychotherapy or meds or whatever else. So there was something there. And after seeing this process used with this population for a few years, I went and got a PhD studying neurofeedback and studying attention in the brain, because I was sort of not satisfied with just the phenomena we were steering. I wanted to understand it better. So I went to UCLA for a few years and got a PhD and studied how the brain reacts to the process of neurofeedback in real time, and looked at the brain's moment of binding to the information as it comes back in, and did one of the first double-blind placebo-controlled studies on neurofeedback, because the EEG is kind of hard to blind. If you move, you see the screen move. If you pull a wire off, or if you cough, you see the signals move. So we created a way with the vendor of the main software in the field called Eager, and to do a blinding of the EEG. And then we ran people through several days in a row of neurofeedback with a full sort of 64 channel cap on top of their head, decomposing what was happening as the brain noticed the feedback. Just to define for folks that aren't aware, neurofeedback is sort of watching a computer screen, and whenever your brain happens to do the right thing on its own that it was already going to do, that you want to sort of reinforce, you applaud what the brain just did by making a game run better. So you're watching a Pac-Man eat dots or a car race or something, and you're training your executive function, which is often on the right-hand side of the head. So whenever your theta dips down, the car surges, or the Pac-Man eats more dots, or the beeps happen or something. So it's this involuntary operant conditioning reinforcement thing.
So it's like playing Mario Kart with the power of your brain without hands.
Brain, not mind. So there's no voluntary, you can't control your brain waves generally. Some folks have some control over them, and some people can control their blood flow. We do some biofeedback or neurofeedback on the blood flow as well, and you can control that a little bit. But for the most part, you can't really feel your brain. There's no sensory nerve endings. You can't tell if certain brain waves are firing. So it's involuntary exercise. You sit down in the chair for neurofeedback for half an hour, get certain modes your brain's already moving into applauded, but most of the things it's doing are ignored. The brain's like, hey, that's interesting. Stuff's happening whenever I drop theta. And after a couple of sessions, the brain reaches for a lower amount of theta later on that day or the next day. And the person's like, ooh, hey, I feel focused. And if you train a kid or something 3 or 4 times and their brain drops theta the next morning or something, and the parent says, hey, could you please take the trash out? The kid gets up and does it. The parent's like, what the heck? My ADHD kid just did a thing. And I get frantic calls like, what's going on? My kid's different.
Yeah, you were able to see actual changes, and you were able to see like these patient stories, and it sounds like your path to this field were very guided by like purpose and meaning. You actually wanted to improve how we treat, for example, ADHD or autism, these kind of like disabilities that might be very hard to deal with.
Yeah, I did. I mean, there was certainly some amount of empathy and compassion driving this, perhaps. There was also a lot of frustration because I worked at one of the most acute inpatient psychiatric facilities for several years. I worked in residential, really acute developmental disabilities with adults for many years, and I didn't see much change. And in the psychiatric facility, I saw the same people come back through, get stabilized for a few days or a week, leave again, come back again, with the same kinds of suffering. And a lot of it, I didn't know this then. My perspective on how suffering happens was not clear in the brain 30 something years ago when I was working inpatient. But now a lot of the reasons that I approach human performance and wellness and biohacking and everything the way that I do is because I do sort of see some final common points of bottlenecks or failures or performance optimization that many humans engage in. So a lot of the things that we have very complicated psychological diagnoses and labels and medications to go after, I started seeing as the medications didn't work that well. Locking people in psych wards didn't work that well. Having them in isolated residential facilities didn't work that well. And then other techniques, I saw non-biofeedback things done with certain populations, like interactive metronome done with autism, and Takatina, which is like an adult version of that, done with brain injury clients. I'm starting to see actual transformation outside of that traditional medication therapy, PTOT kind of space. And it was pretty impactful. So I basically had to go back and get a PhD, mostly to figure out how to, move the needle a little bit. And so we did a complicated experiment, just looking at the process itself deeply. So, yeah.
Well, that is very interesting. And I actually love the idea, like, if there is a brain disorder, if there is a brain disease, whatever it is that's causing, whatever kind of symptom is causing, even if it's ADHD or depression or something like that, even like traumatic brain injury, like therapy seems, if it's biological, why would it be cured by talking? Like we don't treat common flu, or we don't treat cancer with talking. It's biological. It's in your cells, in your tissues. You need something to guide those to the right path as well.
Yeah, and some things are resources and some things are the accommodations habits. So I would say depression might be more of an experience, but most forms of anxiety, most forms of attention difficulty, those are actual circuits. Those are actual like pinched up muscles, and you can see them on a brain map, go after them, and you can stop thinking about PTSD or OCD or sensory issues or social anxiety or anything else as a disease when it's anxiety stuff, and think about it as a resource that's stuck in a certain mode. Generally, most forms of anxiety are us, the brain latching on to the possibility of danger because the cost of missing danger is so high. You don't miss it more than once generally. So there's a bias towards attaching that way. So we get a sensory sensitization, or we get a selecting our focus sensitization, or a evaluating the environment sensitization. And those produce specific disorders when they are acute. But when they're not, the front midline is selecting our focus. When it's really cramped up, it's OCD. When you're using it really effectively, you're a CEO. When it's a little annoyed at you, it's playing songs in your head all day long. But it's not a disease, it's a circuit, so you can learn to look at these things. And that's what moving from that acute psychiatric environment over the past 20, 30 years and doing brain companies and things, I've moved into the realm of, let's not worry about the label for you so much. Let's look at your brain. Let's find some things to work on. Let's steer some phenomena. Let's, create some change for you. But there is a lot of agreement, or a lot of convergence around the different ways and people often suffer. Yeah.
So can you tell a little bit about, do you need to quantify the brain before you do neurofeedback? Do you need to see what's going on and then you start training? Or can you if you have a diagnosis, can you just start training?
It's a good question. There are things you can do without, there are benefits you can get by doing brain training without doing an analysis of the brain. But the more unusual your brain is and the bigger your needs are, the less likely that some one size fits all system is going to work for you. So I recommend most people who actually want to make change do an assessment of their brain to then do tailored interventions. If you do the wrong intervention for your brain with things like biofeedback or neurofeedback, they're generally fairly gentle, even when they're the wrong thing, and you don't like how it feels, and you kind of learn, oh, that's the wrong workout. I'm sore today. Oh, was the seat on your workout machine set too high? Oh yeah, maybe it was. And you can make adjustments, metaphorically here. So you can iterate with neurofeedback and learn. And a lot of practitioners, I'd say a third of the field, doesn't do brain mapping, or this process of analysis of the brain. But we really rely on brain mapping and attention testing to develop a set of landmarks and big resources to help create sort of models with somebody about how their brain works and what they might want to work on and what's most important and how things are feeling. And I find the brain mapping useful even without the brain training. If I can sit down with somebody and show them that their alpha waves are running slow and say, oh, you're probably having some speed or processing issues. Is it hard to load words into your mind? Are you hunting for names? And they're like, oh my gosh, yes, I thought it was Alzheimer's. And they're like 45. No, it's not Alzheimer's. Your brain is slowing down. Let's figure out why. Oh, your delta waves are super fast. You're not getting good deep sleep, are you? Yeah, I'm not. Maybe we should, maybe you should get a sleep study, do some mouth taping, cool your room, because if you can get more deep sleep, you'll suddenly be walking around less sleepy during the day, and the alpha speed comes back up and word finding will improve. So you sometimes can find the thing, the intervention, the biohacking, or functional sort of intervention you might want to do without the neurofeedback, the tech being the next solution. But I do kind of think like the brain mapping is your high-end like DEXA scan and fitness scan and bone density scan. And then most forms of neurofeedback are closer to like grabbing a kettlebell and working out a couple of specific, areas, or doing some compound movements and getting the system to move. You can't be specific. Picking up a kettlebell works out a whole lot of stuff at once, or a barbell does, doing a whole compound exercise. And most neurofeedback does too. It's a little hard to be terribly specific. So you tend to work on big resources like sleep, stress, attention. And that's why I limit myself to some extent to those big modules that we can kind of see. I mean, neuroscience is caught up in practical. We think about the salience network, executive function network, and the default network. Those are big, rich hub cortical areas, and you can see those on a brain map. So you can go, oh, I have ADHD, and look at your brain map and go, oh, executive function hubs. Or you can say, I have PTSD, and look at your brain map and see default mode network hubs. And you can then have more agency to go after it without the language of the diagnosis, more about like, oh yeah, this thing's sore, let's work on that. So there's my soapbox.
Yeah, I love that actually you were talking about the brain waves, and I think there are many misconceptions about brain waves as well in general, like what they are, and people just say like, oh, increase your alpha waves, and does it happen throughout the whole brain, or like tell us a little bit about how brain waves work and what is the significance of having certain brain waves in certain brain areas, for example.
Yeah, that's a pretty sophisticated topic. I probably won't do good justice to today, but a couple things to think about. One is we make all brain waves pretty much all the time. All the slow brain waves called things like delta, theta, alpha are the stuff of life. You live in delta. It's the heartbeat of the brain. It keeps the metabolism moving. It keeps the cells doing their cellular stuff. It keeps your heart and lungs in the brainstem moving. When you're deeply asleep, delta's surging to cause slow wave sleep and wash the brain with an agitation cycle like your clothes in a washing machine. So you need this sort of deep delta waves to live in. And if you have a brain injury, a concussion, apnea, mold, Lyme, anything that makes you foggy, even COVID, you produce extra delta as your brain's feeling foggy. So if you don't sleep well and you feel tired, you're actually making more and faster amounts of delta when you're awake, as your brain tries to make up for the lack of extra delta it tried to make the night before. So that's delta, the deepest, if you will, frequency, slowest one. It's a little surging wave, a little rhythm in the tissue, like a pattern of activity. That's like a motor or a mode that the tissue can turn on. And delta is about twice per second, a little firing wave. And these waves are created by something called microcolumns or mini columns. One refers to the voltage, one refers to the size. And there are about 30,000 little neurons in a column. And with glial cells, which are the support and computational insulation, a bunch of other stuff in glial cells, they're metabolically active, but let's ignore that for a second. Little column of 50, 60, 100,000 glial cells, about 30,000 neurons. And we have millions of these microcolumns. And these are the CPUs, we think, in the cortex. So wherever you go in the top of the brain, you find little clusters of microcolumns, and they're all talking to each other, but the microcolumn itself fires as a computational unit, tends to do the same thing as a whole unit of cells. And you can have a microcolumn dancing twice per second, and that's a delta wave, or 4 times per second, and that's a theta wave. And theta is sort of this, theta runs 4 to 7 cycles per second, or hertz. Theta is sort of lubrication for the brain. It lets things occur that a module wants to do. So if you have a bit of tissue that has a certain job and a theta wave passes over it, it kind of like starts doing its job. There's many things called theta. I'm grossly oversimplifying. For instance, there's a theta around 6.5 hertz. That is the moment of memory awareness, of pulling an idea out of your mind, and receptive, generative memory, basically. You can't make 6.5 hertz. You can't pull things out of your memory. It's kind of a weird phenomena. So there's a few, subdivisions. Next one up is alpha, which is the great neutral, or the resting frequency, like the car in the driveway, just idling and ready to go. And you shift through delta for lots of stuff. You use delta to put tissue into idle before you activate it. It's really lovely frequency, but you also use it as like the basic processing speed of the brain. So when alpha slows down with aging, you feel slower and you have problems grabbing stuff out of your mind. When you're a kid and your alpha slows down, you can't absorb stuff. So if you have a kid who's got a sleep issue and their alpha slow, or a developmental issue, you say something to them and it just slides off them. Nothing gets in because they aren't binding to information rapidly enough. And then you have beta waves, which are somewhere around 12, 13 hertz up through about 40 hertz is the beta wave frequencies. There's many things in there. And beta is where life is, and where thoughts are and perceptions are and experiences are, and the mind is basically. So slow stuff is life, fast stuff is the mind. The beta waves are modular. So you'll find little bits of tissue pumping out little bits of beta as it changes gears. Fast beta, slow beta, lots of beta, a little bit of beta. So that's the activation mode, the gas pedals. And you can put a cap on someone's head. I think you've done this with me, I think, right? And then relax. And I can measure your brain at rest, and your brain, your spectral power, the amounts of brain waves in different regions is relatively similar for you day after day, year after year, like a fingerprint. It's kind of characteristic to you. So what we do is look at where in your cortex, where in the top of the brain, you might make large or low or fast or slow amounts of brain waves, or have different connectivity patterns. And then based on the tissue, based on where in the brain it is, we say, aha, this part of the brain, like let's say the front midline, it's doing this unusual thing. 2 examples might be makes lots of beta, or it might make lots of theta. So a lot of gas, a lot of zzz, verve or zoom in your front midline, and people get obsessed. They have songs playing in their head, as I was saying earlier. They get obsessive. You get lots of theta there, and stuff distracts you and captures your attention. That's more of the songs playing in your head, less of the OCD, more of the like, I'm thinking about, the song's playing again. So you can kind of predict things about different modules. And these modes are then tunable because they're sort of built to a pattern based on who you are, what you learn, and how your brain got built. But they're kind of stable, but also learn over time, especially the resources that are what I call regulatory. The big three, sleep, stress, and attention, are foundational things below the cortex that use the cortex and are changed back and forth. And they really scaffold many of the resources we think of as the mind. Sleep and attention have overlapping brain waves that are shared to produce the architecture of sleep and the control over the attention. If you've ever seen a cat lying on a windowsill watching birds, that liquid, still body and laser-like focus, that's a brainwave state that most animals make called sensory motor rhythm. There's a strip of tissue that runs ear to ear. And when we're still in the body, calm in the mind, we're making lots of this low beta frequency, 12 to 15 hertz in humans. And neurofeedback was discovered in the late 60s because, by mistake, Dr. Barry Sturman at UCLA discovered that some cats he had trained up some SMR in became seizure resistant on another experiment. There was these super cats who were kind of resistant to being knocked over by a rocket fuel exposure, is how the experiment went. But turns out that was a very serendipitous discovery. He trained his lab manager, who was an epileptic, with an auditory feedback system and produced seizures for her with this SMR frequency. That was the core of the field. So mid beta frequency. And now 50 plus years later, we are still evolving our techniques, our practices, our understanding of the brain. But it's reached the point where the average person who wants to get into their brain can actually look at it the same way you might look at your lipid panel and go, ooh, I should probably make some changes and improve my performance, or your bone mass density, bone density or muscle mass or something as an aging marker. You may want to check your bone density when you're a 40-year-old or 20-year-old woman. And then again, when you're a 60-year-old woman, if you have a big drop, increased, risk for long-term health, so you should do bone density, if you have that kind of metabolism, of course, some women do. So there's that kind of stuff, but you can do it with regards to the brain now with your stress, your sleep, and your attention, your big resources. So that's my mission, is to help people learn to not just change their brains with neurofeedback or other forms of biohacking, but to conceptualize how this stuff works in a way that is not about diagnostic labels. And it's not about being out of control. These things feel out of control. ADHD, anxiety, trauma, seizures, migraines, these things feel really like we're out of control when they happen. But
Yeah.
if you can look at the maps and understand them and start taking a little bit of control yourself, that's so empowering that I find that process changes your relationship with your brain quite a lot sometimes.
Yeah, I can actually totally agree with that. And I have done, like, we did this brain mapping. Would you call it quantitative EEG? Is that like the synonym for it? Yeah. Okay, so we did this brain mapping, and you did interpret my results to me. And it was a few years ago, so I don't really remember in detail what was it. But I do remember you were, first of all, I was like, whew, when you say like that, there's nothing clinically alarming there, so like don't worry. But you were able to give like a quite detailed view on how my personality might be like, what kind of a thinker I might be like. And just like you were telling me that, hey, I think it was in the occipital lobe, there was some level of beta wave or something like that. And you were like, you might be prone to a little bit more stress if you start overthinking, a little bit more anxiety. So maybe like focus on stress management, relaxation, and just like taking it easy when you think like you have too much thoughts. Because I am like I'm a very curious person. If I delve into a topic, I want to know everything about it. And yeah, I might overthink and I might overstress myself over work or whatever. So just like that insight, just like it's like, oh, okay, so it's actually seen in my nature of my brain. It's just like that. And there's nothing false or there is nothing wrong with it. I just like, I can like focus on stress management, and this will like be better then. And I think it worked. I have prioritized for the past few years. I've really focused on stress management and just taking it easy and doing things with not in a hurry. Especially this was possible after my studies ended, and then I was able to lose the deadlines and stuff like that. But yeah, I think like I have this experience that you described about, and if you're able to point out something in your brain, like, hey, your brain, that part has more of that sort of a brainwave, maybe do this and that. I mean, that already brings like this sort of a relief, like, ooh.
Yeah. So while I do have techniques to change the brain, and I do help people make lots of transformation, over months usually, I sort of joke that I'm not selling neurofeedback. I'm mostly selling you some agency, some perspective. I mean, like, we should map your brain again. We never charge clients for repeat maps at any of our Peak Brain offices. So you should get a map done next time you're in the States at one of our offices, or I can send you to Copenhagen if you actually, we have someone there who can map you. Anyways,
Definitely, yeah.
so you'll probably have a change, even though it is relatively stable for you. You'll have a change since it's been years since you've mapped your brain. You've had a bunch of big life experience changes. The world's quite different. I would imagine your stress is different. Your sleep is different. Your self-care habits and strategies and things you've learned that to do are a little bit different. That will impact your brain. And if I should show you the old map and the new map and the changes and say, here's a plausible way to interpret this particular data point change, the things that resonate with you, oh yeah, that does feel real to me, will now tell you about your brain in a very concrete way. So you can then build on that, trust the improved stability or improved sleep or improved speed of processing you built up or whatever it is. So we like to provide the mapping at all of our offices without charge again, and clients come do, the biohackers love our offices because they can come in and test paracetam and cannabis and Adderall, whatever else, and just do map upon map upon map and look at real-time data and examine, we have a lot of mutual friends who've done this. Claudia did a methylene blue one recently, Claudia Balog, and
Okay.
other folks have done some maps of their brain on active nootropics. So it's kind of a fun way to dig in, even if you're not trying to solve problems. If you're just trying to develop a better sense of how your brain works and who you are, it can be useful. So I'm a big proponent of using brain mapping not as a diagnostic, because it's not really valid. You're doing population level analysis. I'm looking at you on a bell curve and a bunch of things. I can tell what's unusual, but brainwaves are mysterious and people are weird. The job is not to, hey, why aren't you average? Let's make you average. We don't want that. We want to say, hey, here's some unusual stuff in your brain. Here's some plausible interpretations. Are any of these valid? Do you, are these important to you? Do you care? And as you probably discovered, it sounds like, when I made hypotheses about what is plausible, we found largely valid things. That's the relationship people tend to have with the brain mapping, is more like sitting down and going over, what's interesting here, and less like what's wrong here. Because if you find something real, we can generally go after it and make a change. So it's never I don't want to find out. It's always like, ooh, what's going to be my low-hanging fruit to improve my performance? That's the kind of relationship we try to get you to have.
Yeah. Well, it's like blood work. You just go and do the test and check that everything's okay, or if something declined, then you can kind of fix it or work on it,
Right.
at least. Cool. So, okay, so you mentioned a couple of clinical applications, namely ADHD, autism, but you also talked about just like stress and sleep. And do you tend to work more with people, clinical populations, or healthy populations?
It's pretty split. I would say about a third of my clients are extremely high performers. Now, extremely high performers often have difficulties, but they don't come to me to fix a problem. They come to me to squeeze out more performance, essentially. So I have a lot of extremely, visible, high-level athletes, actors, business owners, high-powered CEO types. And a lot of those folks do have things to work out. They often have a touch of anxiety. They often have some substance abuse history. They often have some, other stuff going on, but they're not coming to me for problems. They're coming because squeezing out a little more performance. An actor remaining calm in front of the press on the red carpet, or a surgeon remaining calm, deep into a stressful surgery. The value of a little bit better performance is so high for these folks. Or a boxer who just lost a fight, who's got some concussions now and has to do a rematch in the spring. There's huge value for some of these individuals with, let's squeeze out a little more performance. Let's remediate some old damage. And then I have about a third of my clients are probably the classic neurofeedback practice space, which is adults and kids with anxiety, ADHD, social difficulties, seizures, migraines, concussions, just basic neurological kind of difficulties. And then because we have a pretty wide sort of peak performance brand, the last third is the rest of us, all of those of us with a mix of challenges and benefits, who want to optimize, who have a wellness perspective. Most people in the neurofeedback field are therapists, and peak brain is unusual in that we are not, and don't try to be your therapist. We are your coaches and your scientists, and we are on your team, and you're navigating your change, and we're cheering you on and helping you back to your data. But we're not taking the agency. We aren't creating a transference thing where we're the expert for you. Would rather make you your own expert, because teaching you your own neuroscience where it matters to you is a smaller ask than creating a clinical container around you that is then well supported, at least at scale, the way I'm trying to do this across the whole world. So we want to create neuroscientists in individual people as they have things they want to learn about, basically.
So that's super interesting. So basically it could be applied, like anyone could do neurofeedback and probably benefit from it. Is there any harms or any risks in doing neurofeedback?
There are risks, but sort of under the perspective of, if you work out wrong and keep working out wrong, it causes trouble and can cause injuries. In the context of neurofeedback, most forms, not all forms, but most forms are passive in that they watch what the brain is doing and applaud it with something that is not very insistent, like auditory or visual information. There are some forms of neurofeedback that do really active stimulation, electricity back into the brain, for instance, when they try to push the brain around. And there's forms of doing microstimulation or neurostimulation that is not neurofeedback, that is simply trying to push patterns into the brain with electricity or magnetism or whatever else. Generally, all of those things do not produce rapid change, and the brain's a system that has lots of places where it's trying to maintain efficiency and stability and a bunch of resources. So you can kind of push it a little bit and it swings up a little bit and then swings back to where it was for the most part for most things the brain experiences. So just like that with neurofeedback, you can push on a little bit and get an experience and then get it to go back. And the person can go, oh, I kind of liked how that felt. Yeah, let's do more of that. Or maybe it's a mix. So maybe we try training up beta on the left-hand side, which we might do for inattention. We also might do for deep sleep. So if someone has lots of slow brainwaves on the left side and they need some support there, we train it up. After a few sessions, they'll come in and say, oh yeah, I actually felt really focused, really clear. It was really great. And when I got to sleep, I slept really deeply. It was awesome. I had a really hard time falling asleep though. Once I got to sleep, no problem. But the transition was weird. Okay. Let's iterate. Let's think about what that means. Let's back off a little of the beta waves, try a version of it. So the client has this personal trainer / athlete relationship where they're like, ooh, how do I feel now? And you can get thrown off. But it's the side effects of neurofeedback are kind of like calling your trainer from the supermarket and saying, dude, I dropped eggs all over the floor in the produce section. My arms are noodles. What are you doing to me? Because they worked you out too hard with curls that day or something. Neurofeedback, it's, whoa, I felt too focused or kind of wiped out or kind of dreamy, or I had some rebound anxiety for a little bit, and then it wears off. So if you're blindly expecting that we have magic tools for you and your therapist thinks that they know everything and don't actually check in with you, you can get progressively pushed in the wrong direction. And I do have inbound prospects every single week, people that use a one-size-fits-all neurofeedback system that they buy or rent and use for a while and get pushed further and further and further towards anxiety and sleep disruption. Those are the common things that happen when protocols land poorly. So if you're average,
Are these mainly like the risk of some consumer devices that you can just order online and train at home, or does this actually happen at the clinic as well?
it does both. Yeah, anything that works can work in the wrong direction but you have to, again, work at it in the wrong direction. So you have to sort of over trust that it's doing the right thing and ignore side effects and reinforce them over many sessions generally to get bad effects going. But it happens. I've had folks that were supposedly pretty high functioning autistic come into my office, stimming and flapping and no eye contact. And the mom said, we trained 80 sessions with a one size fits system with one protocol I got from somebody. And they got worse and worse and worse. And the autism regressed. And we had to kind of back it out over the next few months. That story has a good ending. That kid graduated about 2-3 years ago now, valedictorian from his small liberal arts college in the Northeast. So
Wow,
he really had
that's
a
great.
lovely, we recovered the problem, so to speak. But even now, every single week, someone calls me and says, oh, I bought a system. I paid $2,000 a month for it or 10 grand for it for unlimited sessions.
Mm.
And I've been using it. And it got a little bit worse. But I asked the person I bought it from, they said to keep doing it. And things got worse and worse. And now I'm always anxious and can't sleep and I don't feel good. And it happens all the time. So, or someone says, oh, my practitioner said I should just keep pushing through it because it might get worse before it gets better. That is not true in neurofeedback generally. You might get away with making things worse on the way to getting better, but you don't have to ever make things worse to get them to feel better. So if you feel bad after a session, like, a workout shouldn't be painful the next day. It should be, oh yeah, I felt my muscles. But if you have too much DOMS, there's no reason for that. There's no reason to push yourself to the point of pain and stiffness, and you can't get off your couch when you work out. There's no reason to push your brain that hard either. In fact, we don't want your brain to react to a training protocol. We want it to gently move in response to one over time. And you can land hard, you can create side effects, you can create dissociative states, you can mix the wrong neurofeedback. Like someone has general anesthesia and you do the wrong neurofeedback the day after, and you just create profound dissociation.
Yeah, so this kind of emphasizes the fact that if you are starting with just totally new thing like a neurofeedback here, it's maybe good to work with a personal trainer. So like a professional neuroscientist who knows what your brain is supposed to do, how the treatment outcome is supposed to be, and can then evaluate, are we going in the right direction or not with it?
Yeah, and again, I would emphasize that your neuroscientist, psychologist, or trainer isn't necessarily somebody who knows everything either. It's kind of like having somebody teach you to ski. Then they say, there's the path down the mountain. There's the trees. Head down the path, not down through the trees, because you're more likely to get good results if you head down the mountain path than if you ski through the forest, And they'll meet you at the bottom and help you adjust your technique. That's sort of the role of the neurofeedback trainer. They're helping you with like, oh, let's try this version now. Let's try this exercise. Try that. And the good neurofeedbackers don't believe what their machines tell them in terms of diagnostic labels or outliers. They use that to develop models, mental models about what's happening for the client. And then they help the client validate the experience. I mean, I joke to clients that this is a very, mysterious experience, but it's not at all blind. You experience stuff. So we'll figure out if our ideas about your brain are valid a few days into training your brain, because whether or not you get the effect is a very clear experience. So, we get to evaluate stuff instead of deciding. I joke that if you want answers, you go see a doctor, but if you want questions, come see a scientist. Or things to try, come see a scientist. We'll give you lots of stuff to think about and try and evaluate and model and push on. But we're not necessarily trying to get to the inviolate truth. Doctors have diagnoses and the medication. Trainers, scientists have iterative approach to get closer and closer to things you're looking for. So we work in that scientist coach way for you instead of therapist. And most neurofeedback people do too, even the ones that are therapists, which is most of them. They still work as this iterative support system for you in some ways.
Well, that's all good info and good reminder of just be a little bit of wary of all of the things you can find on Amazon, I guess. So how quickly does neurofeedback start working? Let's say we have a typical ADHD kid. How fast would you expect to see some changes? How many sessions, for example?
I would say regardless of what it is you're working on, or nothing at all, just experiencing some peak performance work or creativity or something, you feel, most people, and this is a bit individual to the person, most people feel neurofeedback sessions start landing about the third or fourth session in. I would say about 1 out of 10 or 15 people feels it the first time. Maybe 1 out of the same 10 or 15 people kind of has a sense of it happening, but never really, but things change anyways in their sleep, stress, et cetera, over the next month or two. So in the case of a classic difficulty that you can measure, like ADHD or PTSD or something, we do attention testing alongside our brain mapping. So we actually have really good sense of how the change occurs for ADHD, for instance. And we like to do a minimum of about 40 sessions for everyone, regardless of what you're doing, because that's enough training.
4-0.
What's that? 4-0.
Did you say 4-0? Oh, okay.
I like to train a minimum of 3 times a week, roughly. uh,
Okay.
for 3 months and map the brain every other month, roughly. And that 40, maybe 50 session course of training is enough to create a couple of standard deviations of change on a bell curve in attention. If you have any need at all there, any deficits at all, like ADHD or a concussion or something causing big attention trouble, we can reliably move you up the bell curve about a standard deviation every 20 or 25 sessions. So that means that if you do 40, 50 sessions with severe ADHD, you probably don't have it anymore. You may have a hint of it. And if you have anything beyond severe ADHD, you might even be above average permanently afterwards, after 40 or 50 sessions. Not everything changes that robustly and reliably. Working on sleep, stress, and attention generally does. Working on things with active disease processes pushing back against them does not, like schizophrenia, or someone has a lot of damage from drinking or something, you might need more training. Or someone's got autism, it's a different brain, or a lot of brain injuries, it's kind of a different brain, you might need more training. Now you need 50 to 100 sessions, 200 sessions. But generally people will do with us and in the field in general, something like 50 to 100 sessions to address OCD, PTSD, sleep issues. Some things that are more systemic, like migraines and seizures, are not usually eliminated, but knocked way back. The system's made more stable and resistant to being destabilized. So the literature shows that the average response to seizure is about a 50% reduction in seizure incidence. I've never seen a result that poor. It's always like, oh my goodness, the seizures are going down. That's really cool. And then the person gets stressed out 2 years later and stops sleeping well, and seizures creep back up a little bit. You train and they go right back down. The same is true of migraine. It's a thing that you can work at if you need to in the future. But ADHD, big anxiety stuff, flow state access, we do alpha theta work for a lot of our flow state, peak performance clients. It's a permanent kind of access change over time, that you can get access, you can get built up basically. So we don't really have to do long-term training unless you want it to keep making improvements for most people.
Do you have any very striking or surprising or interesting patient story that you've seen through neurofeedback? I completely understand if you cannot share, or if you can somehow make it very anonymous and share something that would be that was something that maybe you didn't expect, or something that was more than expected.
I mean, it's more that I just wouldn't know where to start in finding, because in working in traditional psych, my perspective on how change happened and how suffering happened was one way. And moving into neurofeedback, I expect 70, 80% of my clients to eliminate their big stress, sleep, and attention difficulty, even when it's really severe, in a few months. So most of our clients go through life-changing transformation rapidly. So there's a podcaster named Kelsey Dara who talks about, I can of course give you public stories that are public. And Kelsey talks about having a lot of anxiety and really hating to travel, and planes make her feel horrible. And she would abuse alcohol and Xanax whenever she flew, because otherwise she couldn't deal with being in a plane. And we did a bunch of neurofeedback with her for a month and a half or something. And she had to fly from LA to Boston or New York, I forget what it was, it's on the East Coast, 6-hour flight. And she found herself she got to the airport late, was stressed out, got a middle seat because she got there late or something, hated it, was extra stressed out, and was landing on the East Coast before she remembered that she had Xanax in her bag and had forgotten to order any alcohol because she wasn't that stressed. Wow. Instead of every plane trip being a massive life, battle to get on the plane, to numb herself. And I've heard that from 50 people who can now fly in a plane, drive across bridges, not get triggered by their, anxiety trigger or whatever. So the really severe anxiety stuff is reliable. That's my most favorite thing to go after in some ways.
What is it in anxiety that you train with neurofeedback?
Depends on the flavor of anxiety. There's specific circuits, as I alluded to earlier. Anxiety is not a disease process per se, like getting a cold or having an injury. It's more like having a resource that's a strong resource that's supposed to do one thing that cramps up and gets stuck. So in the cortex, I tend to see the anterior cingulate when we're over-focused. That produces obsession, OCD type anxiety. The posterior cingulate's evaluating the world around you. So if you drive a car and you get distracted, the posterior cingulate says, watch the road. Or someone yells, hey, Inka, heads up, and you grab the Frisbee or something. That's a posterior cingulate. Good job, orienting you to the environment. But when the brain learns the world is not safe or predictable, it starts evaluating in high gear all the time. And that's PTSD if it's extreme. Or there's a part in the back right that takes the whole world in as the junction box called the tempoparietal junction. And if that's hot in somebody, then social information and sensory information is literally louder to you. So faces get loud, people's anger gets loud, sounds get right through you. So lots of things are in that sort of nails on chalkboard category. It's a big bucket suddenly with all kinds of things in it if the back right has that sensory or social anxiety. Or if your eyes are closed, the visual system, if I see it not shutting off with your eyes closed, I might predict somebody's having hypervigilance. The brain can't stop scanning or preparing to scan the environment, even though the eyes are closed. The brain's like preparatory, vigilant, if you will. So for all these things, I wouldn't assume I knew for you or for anybody that they were true, but I would say, aha, hey, let's look at your brain. Hey, look at this. Is this plausible? Do you kind of ruminate? Are you a little threat sensitive? Are you hypervigilant? Oh, you are? Ah, that's annoying. Sorry you experienced that. Glad we're seeing that. Would you like to change that? Would you like to work on that? I bet if this is valid, I think it is. I bet if we lean on this and exercise some beta down, bring some alpha up a little bit, you'll be like, oh, that's nice. And if we get that effect, we can build that over time and take like the threat sensitivity someone might have, the trauma response, let's say, which is really common these days, even when it's not PTSD level. The world is so hard for so many people, and the sense of powerlessness and being out of control in the global context these days is so high that everyone's really threat sensitive. So you might want to drop that or reduce the tendency to sit there and chew on stuff and worry about stuff just by training down the beta at the posterior cingulate and bringing up the alpha. So your resting level is not, it's like, chill. And then you can go there. That's an important point about neurofeedback. You're not tranquilized. If you're someone who has PTSD or OCD and you train down the cingulates, so you're a Zen monk when you're not in high stress, you can still move into high stress modes whenever you need to or want to. You just don't have to stay there. You can put down the hyper focus whenever you feel like it, or put down the worry if you feel like it, and then pick it back up again when you're in the middle of a car accident or a dark alley or whatever. So that's please.
It resembles a lot of this idea that many people are afraid that if they, I don't know, train mindfulness or stoicism or something like that, they become emotional zombies. Like, it's just that you have more flexibility to choose in what kind of a brain state you want to be in certain situations. So when you actually do need to calm down, you're more readily able to use that skill of controlling your own nervous system and your own mind or brain in a sense that benefits or is adaptive to the situation.
Yeah. And even before you make a change, as I was saying earlier, you may discover something about your brain that is true and go, yeah, okay, I am kind of anxious. I see it in my maps. Oh yeah, that's true. Oh yeah, I do worry a lot. Oh, I do get caught in high gear. And then you can do non-neurofeedback things like Dr. Huberman talks about. He's a research neuroscientist and a vision scientist. And he talks a lot about how the direction of the vision will change how rapidly you process time. So what I often coach my clients in a panic attack is if they're ramping up and activating, that means they're looking down at peripersonal space, things you can potentially reach or things that can reach you, stuff that's around you. And your mind's going with time, trying to slice up what's around you. But if you look up and away at a vista, like the ocean, the sky, or straighten out your vergence, the direction of your eyes changes, your brain notices that and slows down time processing into these little like 300 millisecond slices now, instead of like 50 millisecond slices. So suddenly you actually slow down. So if someone's, you can teach them. And that's not like mindfulness or breath work. You don't have to learn it for it to work. The eye direction time processing thing is built into all animals, probably, and definitely humans. So it's a
interesting.
So that,
so looking up is like calming.
Yes, because the brain assumes that what you're looking at is far away. You have time to deal with it. Now you're on a boat or a horse, or you're walking, looking at something far away. You have the opportunity for pulling memories out, for making abstract thought, for loading things into your working memory, for making creative decisions. The cost of not doing those things, there's no cost for taking time. If things can touch you, or you can touch things and they're all stressful, There's no time. You can't think abstractly. You can't go, huh, I wonder. You have to act, you have to react. So that's why the brain's like, these little 50 millisecond slices when you're ramping up in your stress. But you can literally just go, nope, I'm now downshifted. Once you know where it is, you don't have to practice it. Just try it once. Go out and look at the sky once, the ocean once, and go, oh, that's what he's talking about. Oh, okay. And then all you have to do the next time you're ramping up with your stress is remember that that lever is there and reach for it, and it will be there. It's nothing you have to learn, unlike mindfulness, which I don't like mindfulness for anxiety interventions because it can really just make it worse until you get beyond, the learning of it essentially. Or breath work. Breath work's hard to do if you're anxious. I will say the only important thing to remember if you're having anxiety and you are trying to do some breathing is make the length of time that you exhale longer than the length of time that you inhale. That will drop the sympathetic tone and put you back in parasympathetic a little bit. So if you do a
Yeah,
it will slow you down, but you have to remember to do it. And you might be like activated, having a hard time controlling the system. But if you look away, it will work. There's no chance of it not working. It's built in.
That's a great tip. That's a very, very nice, because I think like when people are anxious, they just want to like something fast. That's not the time to start sitting down in a lotus pose and think about what kind of a meditation technique should I use here. Yeah, cool. So, okay. So we have talked quite a lot and covered quite a lot about neurofeedback, and that has been like very fascinating. I learned so much new things, and I would like to know, because you have so much knowledge in general about like total health optimization, brain optimization. You don't only look at one specific single area, but you have actually like you have more holistic view on the whole system. So what would you say would be like the second? I mean, I know you have a lot of tools, you have a lot of expertise, but like if you had to name one specific effective brain health enhancement thing or brain longevity enhancement thing, what would it be besides neurofeedback?
I mean, of course, what you choose and how you implement it is largely dependent on what you're trying to solve, right? If there's an acute difficulty versus performance optimization versus long-term aging, you may want to emphasize different things. Like how, like the word, I'm sure you're into fasting because you're in our community of biohackers, and everyone argues about what breaks a fast. Well, what breaks a fast is different depending on why you're fasting. For seizures, for cancer, for, body recomp, different rules, different reasons. So I think that that's a hard one. There could be lots of things you could do that could be the number two. Those could be fasting stuff. It could be resistance training. It could be macronutrient partitioning in your diet to handle insulin swings. I think it might be sleep. It might be sleep optimization. And I would say that will improve other stuff you're doing. Sleep optimization improves neurofeedback. We can improve it with neurofeedback. We can improve sleep with neurofeedback, but if you hack your sleep behaviorally, you get better effects on neurofeedback and everything else. So I would think watching your sleep with, an Oura ring or a Whoop strap or something good, watching the heart rate variability changes throughout the night, making sure that the deep sleep you're getting is sufficient is about the number two, I guess, thing we can do. For optimization. I don't really care about most of the data coming in these sleep trackers, by the way. The only thing I care about is your deep sleep numbers. I've had long conversations.
And why is that?
Because they're not valid. The numbers aren't valid.
But why is the deep sleep important?
Because that's the delta, and that's the restorative mode. That's the rest and repair mode. That's the growth hormone release. That's the memory consolidation. That's the one. That's actually sleep in some ways, is the delta mode. We need to go in and out of it for sleep architecture in cycles, but getting delta, it's also another reason is that sleep trackers like the Oura and whatever else, none of them do REM very well at all. It's like a magical estimation that is just not accurate. But REM also is not something that changes much in human brains until things are very, very bad. I have clients being like, oh, my tracker says I don't get more than a few minutes of REM. I'm like, oh, are you psychotic? No, you're getting plenty of REM. That's really the rule. If you're hallucinating actively all the time, something's wrong with your REM. If you're not, it's fine. Seriously, that's about how strict it is. REM is protected by the brain in a bunch of ways. Deep sleep is not protected the same way. If you're stressed, cortisol, if you have less time, deep sleep will flex night to night. So you can measure it somewhat reliably, and it is impacted by behavior. So it's actionable. So you can watch the number and you can then do things night to night. So some rules are: move low intensity exercise before you eat in the morning, not high intensity. Don't call for more cortisol or call for more glycogen. You get resistant to those things, but work out just enough to burn them off. 10 sun salutations or something, or a low-key yoga practice, walking, stretching, something you can talk over for exertion levels. And then move your resistance training, your kettlebells, your whatever, to the afternoon. So I saw your Instagram, maybe it seems Instagram today, when we're being lifted up. He should be doing that in the afternoon, pressing you in the afternoon, not in the morning. Because in the morning, he may call for more cortisol if he works out too hard. Now, he probably won't, because he's Mr. Left dialed in. But the average person who goes to the gym first thing in the morning, loaded up on coffee and hits the weights hardcore, is calling for tons of energy to be deployed. The body's woken up by a cortisol and glycogen signal. The cortisol squeezes your liver, feeds you breakfast, blood sugar goes up, you wake up, and you should have enough energy to go out in the world and hunt your breakfast, evolutionarily speaking. If you move from the bed to the couch, or the bed to the desk, or the bed to the breakfast table, and you become sedentary after waking up, or you just take an energy after waking up right away, it's a confusing signal. The body's like, wait a minute. So you should really burn off the energy that woke you up, but not call for more, and only later on consume calories. That's a really, the most powerful sleep hack is when you eat, not light. I know our biohacker friends love light and love to hack with light and love to use glasses and things. I don't care about blue blockers. I don't think they're useful. But morning light is somewhat important for circadian rhythm, and morning activity is really important for circadian rhythm. But the number one exogenous cue for circadian entrainment is actually when you eat. So number one rule for not screwing up your circadian rhythm, not screwing up your deep sleep, is don't eat before bed. Give yourself, if you're metabolically healthy, 2 hours, or a kid, 2 hours. If you're metabolically not that healthy, try 3 or 4. And let your insulin drop, let your cortisol drop, let your everything else drop. If you go to bed with any insulin, which you will have if you're chronically elevated, or if you have eaten before bed and blood sugar goes up, if you're falling asleep with any insulin in your system, guess what? No growth hormone release for you when you're asleep, which means you aren't dragged down into deep sleep. You don't rest and repair very well. You don't restore tissues very well. So about the worst thing someone can do for their sleep and for their brain is to eat before bed.
This is like such an interesting topic, and so many insights that I already got when you were talking about this. Like I kind of want to do another episode of this, just like insulin and like at the brain. And yeah, it's also very important considering things like Alzheimer's risk, both deep sleep and your insulin.
Yeah.
So it's a
hugely
hugely important topic, I think, to think about in our everybody's life, even though you're not like metabolically at the moment having any problems, but like you need to prevent them to happening.
Right. And I have probably we should do another podcast, but I have a whole bunch of techniques that I use for doing sort of insulin resensitization, body recomp, anti-aging from a body perspective to support the brain. And a lot of that is around sort of not just listening to what the keto gurus say about how many carbs you can have and how much fat you need, but actually measuring some things in real time and sort of steering the process, if you will, of the metabolism instead of just following people's rules. So we can talk more about that. I'll leave that as a tease maybe for folks.
Yes, definitely. That sounds like an interesting episode. Okay, one thing that I like to ask to kind of wrap up is what is the one thing that you would tell to your younger self in terms of like just being healthy, or one life advice that you would give to your younger self right now at this age with all the knowledge you have?
I grew up in a farm town, getting up super early and going to a farm to work and pick fruit, or to get up before dark and bicycle for miles to a bakery and start baking at like 3 and 4 in the morning. when I was a teenager and even younger. And then throughout college, I lived a normal stay up late kind of life. And I worked in psych hospitals and was super, working 3 jobs all the time and staying up all the time. And somewhere around like 10 years ago, I started getting to this habit of getting up like I used to when I was a baker or a farmer, getting up at 4 a.m. at the latest. And I started doing it because of what I learned. I coach a lot of folks, not in neurofeedback, but in general life stuff. And I started doing a lot of work around morning routines with some of my most productive people. And you want to practice what you preach. So I started dialing in my perfect morning routine about a decade ago or more. And it's a ridiculously powerful hack for me. And I don't know why, but if I get up at 4 a.m. instead of at like 7 a.m. or something, I need much less sleep. I'm much better regulated. My circadian system stays entrained, meaning I get a sleep urge when it's right time. I wake up naturally with no alarm. I don't know what it is, but for me, getting up significantly before dawn, like when I teach the circadian things, it's always about that light is only present for about 1 hour after dawn or after sunrise, is the color of light that will train the circadian rhythm to the vasopressin system in the suprachiasmatic nucleus. So you want to get morning light. But for whatever reason, getting up for me 3 hours before dawn or something produces this dramatically different experience of life. And I don't know why it is, but what I would have told myself as I entered college is, don't give up that baker farmer lifestyle. Still get up at 3 and 4 in the morning, because it does something magical. I don't exactly know what it is, but whenever I've lived that way in my life, everything has been significantly easier. And I've had every
Well, oh.
sleep cycle you can imagine, so.
Can I ask, when do you go to bed?
Between 8 and 9, usually.
Okay, yeah. So you get like a solid, proper 8 hours of sleep.
Yeah, 7.5, 7 sometimes.
Nice.
What I find is I can get away and not notice it with about 6.5. And I really enjoy and feel well rested about 7.5. So as my life gets more stressful as an entrepreneur, I'll stay up a little late and I'll get a little bit stressy, and I'll realize, oh, only getting 6.5 hours sleep, but my Aura ring is still happy with the quality, and I'm still happy with how I feel. I just know that where the edge is for me, because I've watched it fray historically here and there, and I'll be like, oh, getting up too late. And the solution is not to sleep in. This is what I tell my clients: never sleep in. If you want to sleep in, the time to sleep in is at the beginning of the night, never at the end of the night. Because that's
a good advice. Yeah. Thank you for your time, and it has been a super interesting discussion. Can you also please share how to get more information about what you do, like your clinic, and where people can find more information?
Sure. Thank you, Inka. It's great to see you, and I'm happy to spend some time talking with you today. My company, Peak Brain Institute, is in several states in the US, and we also have several partners overseas. And many of our clients never see a physical office because we do all of our work with brain mapping and brain training remotely with gear sent to you. So folks can visit our offices or our partners. We have ones in the US and a couple in California, one in St. Louis, one in New York City. We also have partners in London and Copenhagen who can do some mapping, and we're about to be available in Hong Kong and a couple places in Australia. But even with all those offices, that probably is only a quarter to a third of our client contact. And we send out a lot of little brain mapping amps and gear and teach people how to do stuff. So if you want to work with us, we can be your brain coaches no matter where in the world you are. But if you are near one of our offices, we'll give all the podcast listeners a discount, and you can have a half price one-off fee with free repeats to the offices, at least in the US, the ones that are branded Peak Brain. We'll just give you a brain map for, I think it's $249 is the discount price we'll give listeners. And I'll do that the same discount if I'm doing it at any conference or anything for you as well. But like for you, I've given you one already. We should do a repeat for you because we don't ever charge them repeat, Inka. So I'd love to see over the past 4+ years, whatever it's been, how your brain.
Yeah, so, definitely.
So Peak Brain Institute is our company. You can find us on socials. I'm Andrew Hill, PhD on socials. And the company, I think, is usually Peak Brain LA, because that was our first city. Looks up there. But I would encourage folks to get in touch if you have brain questions or want to check out your own brain, because we can show you some things about yourself.
Thank you for listening to the Mind and Psychology podcast. I'm Inka Land, and today's discussion was with Dr. Andrew Hill, a cognitive neuroscientist and the founder of Peak Brain Institute. If you liked this episode, please leave a 5-star review on iTunes, as this really helps me to spread the word about these topics. You can also subscribe to your preferred media, whether it's YouTube or Spotify, so you'll find new episodes easily. See you next week at the same place.